Welcome to the Entrepreneur Podcast, filled with marketing and leadership tips on launching and growing your business with your host, Deanne Mora.
I'm here with Dr. Zenia Aguilera, who is an ophthalmologist and is in the process of launching iHope Clinic. Welcome, Doctor. It's great to speak with you today. I'm curious about what it was like growing up for you. Where are you from originally, and what was life like for you when you were a kid?
Hi, Diana. Thank you for having me. I was born in a small city called Holguín in Cuba. This is in the north part of Cuba. It's about 1 million inhabitants, so not too small. And I was the younger of 5 kids.
Wow, big family.
The only doctor in this family. So you can imagine we lived with very few things. My parents struggled during that time. However, they made it work for us. I remember how safe was my neighborhood, and we played a lot outdoors. It was very fun. However, we didn't have no TV, no electronic devices as the kids have today. The most important thing that I want people to know that at very young age, I was an indoor school. I was away from my family since I was very young, so middle school and high school. It was hard to be away from my family and my siblings. However, I think that was the foundation of my character, my personality, because I developed the value that I practice today, like discipline, empathy, and a sense that everything is better when we work as a team.
Definitely. Boarding school at a young age is a tough adjustment. So you would have been, 8 or 9 when you?
10 years old.
My goodness, that's very young to move away from home.
Yeah, very young. But it was fun. I made a lot of friends that I still have it from that age, from that time, and but made me very disciplined. That's why I'm like this, very, very disciplined, and Brazilian. That was the foundation of everything.
You had to grow up very quickly, right?
Mm-hmm.
Yeah. And where are you in the birth order? Are you the oldest?
The youngest.
You're the youngest?
Oh my goodness. Yes, you can imagine, the youngest one. And all my siblings and my are alive, thank God, and I'm now helping all of them.
That's wonderful. Are they all still in Cuba, or are they here?
There are 2 here, and there is 2 there in Cuba. So I'm helping them.
That's wonderful that you're able to do that.
Mm-hmm.
And what you said, you were very disciplined as a kid, so you were very focused on your studies, I'm assuming?
Very focused. I was very smart. I was playful, but also a strong character and bossy.
Interesting.
I was bossy in the beginning. I'm very competitive. I want to win all the contests, and I want to be the first one in everything. So that as a kid I think I keep it, all of these characteristics.
That's interesting. So what inspired you to become a doctor?
Oh, yeah. So my parents didn't want me to be a doctor because they see the doctors, studying so much and working so much. However, I'm a giver. I'm very altruistic. I know this is something that is not a kind of positive thing because you're just thinking others, and that was a calling. Honestly, I love what I do. I feel in my son. I feel in
It's part of your core, part of who you are.
So, but if I'm home, I'm not feeling well. As soon as I'm in the hospital and seeing patients, that I feel so good.
Wow, that's amazing.
That's true. I mean, no matter how many years I have spent doing this, all my training, and the residents that I train now, I just feel so happy despite of all of these years working and all of this years, because I really love what I do. And I was very curious to know how the body works, the physiology of the body. And And this combination of curiosity and passion to help others made me become a physician.
And why ophthalmology?
Ophthalmology, curiously, I was seeing blurry, and I went to see an eye care provider. I was in the second year of medicine, and I was fascinated seeing them the way that they do all of the examination and finally give me my first pair of glasses and see so good that I said, wow, that was really cool. So how they made my vision perfect, and then I started very curious to know how their eyes work. And also at the same time, one of my relatives had a very bad accident that damaged his eye, so he was blind from one eye, and I made a commitment to help people to have a better vision.
And were you in medical school already at the time
Yes.
when you saw the ophthalmologist?
Second year of medical school, so I was involved from that time very early with ophthalmology, because then I become like an assistant for the Department of Ophthalmology, like instructor for them very, very young. So many years. When I'm looking at your eye, it's like those are my eyes. I want to see it for me and get it better. That's the way that I see it.
That's wonderful. And how many years have you been practicing?
Oh, okay, so many. I finished actually. I started doing my residency training back home in the 90s. So you made a calculation in the 90s. So many years.
Okay, lots of experience.
Yeah.
Now, I think sometimes people get confused with the different health provider titles. So there's an ophthalmologist, optometrist, optician. Could you explain the differences?
I'm going to make it very simple. Ophthalmologists are the top of everything from the eye care provider chain. What that means, that is a medical doctor who went to medical school to train about the whole body, and then they made the specialization in the eyes. And not only that, they do a student specialization, okay? So they not only made the diagnosis, treat, but also do surgeries, okay? But on top of that, they made all the work that the optometrists do in a better way, because they have more knowledge about the human being, the human eye, and then improve the condition, treat it, and do surgery.
So they understand the entire physiology and how it interacts with the eyes.
It's the top of the chain. So the optometrist usually refers the most complex condition to the ophthalmologist to fix it and operate it. But we also go on the simple thing just to not simple, but I mean, just the test for the glasses as well, and contact lenses, etc. So in fact, when the optometrist has difficulty to fix that, they usually send it to us.
So if someone is having, all of a sudden they're noticing problems with their eyesight, is it best for them to go to an ophthalmologist directly? Because if there are other disease or other issues that may be causing that decline in eyesight, that you would be able to pick that up.
Yes,
based on your training.
Obviously, the thing is that the system, the way the health system works, made a little difficult for the patient sometimes to reach us first, and sometimes when they come to us, it's already a little late because they go to an optometrist first and then they wait to see us, and sometimes it's a little late. So the system facilitates that the patient will have a problem and come to us first, then a lot of side will be safe, honestly. So I always recommend it for example, for my point of view as pediatric ophthalmologist too, if I can be able to see the kid first, it's amazing. But because many times we don't have too much time with the kid in terms of eye problem, because they may develop very quickly lazy eye if they don't be treated soon by us. So they go to the optometrist first and then with us to see us. Take a lot of time. But answering your question, yes, I would prefer that they come to us with a very serious problem, and then we probably stay their sight.
So given all of your tremendous experience with pediatric ophthalmology, as a parent, what should I look for in a child to know that I should bring them to see you?
Mm-hmm. Yes, parents, I pay attention a lot to the parents. Absolutely every single concern that they have, I take it very seriously because they are with the kid all day and they are looking everything. If you see any change in the visual behavior, you see the child is even touching the eye a lot, or is squinting too much, is blinking too much, is touching the eye, is starting jumping into things, and they have difficulty with the light, it's bothered too much, or they are very scared in dark conditions. If they notice that, for example, the pupils are smaller or bigger, or the eyes are going in or out, or a lot of teeth or the chart or redness, etc., they have to take it seriously. To no way, because we are in a country that has the best health system in the world, and many things can be safe if we go to the doctor. So and usually they are the ones to tell the pediatrician, I think there is something wrong with my baby's eyes. And most of the time, most of the patients that are referred to me are the parents that they notice some problem. And sometimes the pediatrician say, no, that maybe is better, that baby is normal, let's wait a little bit. There is no age let's wait until it be a little bit bigger, older. No, I can see the baby even right after birth. If there is any concern, we will be there looking at the eye of the child, because as I told you before, there is a critical period of visual development. It's just the first 2 to 3 months. I was called from the hospital the other day, a baby just born 2 weeks. He has a cataract.
Really? I didn't realize that infants could get cataract.
That's my specialty. So in 2 weeks, I need 2 more weeks. I have to operate him at 4 weeks of life.
4 weeks.
No more than 6 weeks of life. No younger than 4 weeks of life. No more than 6 weeks.
So you have a very narrow window in order to remove that cataract successfully.
Especially when it's only one eye, the one that has the cataract. If the cataract was in both eyes, I have a little bit more, 3 months of age of life. Okay, so I have to. So if the father, now they say, oh, I see a white spot in the eye, I have to see the child as soon as possible.
So a white spot is a danger sign with an infant.
It is. So I take it very seriously, because it's not like an adult. You develop the kid doesn't need to have cataract. A cataract is something no good to going on. So
could that lead to them losing the vision in that eye?
Obviously, because of the critical period of visual development. Then I may operate them and they don't reach the potential in their vision. So that is serious. And sometimes pediatric ophthalmology, I call the Cinderella in ophthalmology. Yes, and I hate that. So one of my commitments was, first, I have to show the new generation of ophthalmologists that pediatric ophthalmology is the most important one, So, and I made a commitment to when they rotate with me, that they do all the time, they become in love with pediatric ophthalmology. Most of them want to be pediatric ophthalmology. They start like a pair, they start to having an affair with pediatric ophthalmology because I make sure they like it and say the side of many persons.
Yes, well said. Because we often associate ophthalmology with when your eyesight declines when you get older, but not as much with the pediatrics. Mm-hmm. And there's things, as I understand, that you can do to help children physically as well, that they may be teased for certain things. And can you talk to me a little bit about some of those procedures?
Yes. More than 60% of the pathology that we see is we call strabismus. It's misalignment of the eye, squint eye, wandering eyes. And unfortunately now, with in our society, the People pay too much attention to the look, the way that they look, and it's true that even little kids. There has been some study that show kids with a misalignment of the eye, and we ask the other kids that they have the eye straight, which one you invite to your party. They do not choose the one with misalignment of the eye.
Sad.
It's very sad. It's very sad. Even when older adults, that I also operate on the older adult with strabismus, misalignment of the eye, they don't get the same job opportunities. Mm-hmm. They sometimes have very hard time to find a good job,
We judge so much by appearances.
Exactly, and that is really sad. But in adult, it's more for a cosmetic. It's not really for a cosmetic reason, but in kids, it's not only cosmetic because if the eye is misaligned, the vision is no good. It's not focused in the correct place in the eye, and then become lazy.
Well, that limits what they can do in life as well.
Exactly.
Whether they could pursue a sport that they love, and even I'm sure studying becomes more difficult when they have trouble focusing.
Obviously, because you lose the stereo vision. You don't see the depth perception is not the same. So that's why when I have a kid with strabismus, I try to operate around 1 year of age or even younger to develop the depth perception, not only the vision, but also the high quality of vision that includes the depth perception. So, but yes, it's cruel. It's people teasing and bullying them, and you can see there, even younger kids that don't think about that, how the family dynamic change when the eye gets straight. The parent comes so happy because just talk to everybody to think, is something wrong with the eye, with the child's eyes? What is wrong with them? And they feel
they're being called out as an exception for so long, exactly. And now suddenly they're quote unquote normal.
And then also this guilty feeling that the parent has that they made something wrong because the baby born with the eye like this, So when we operate and they look straight, everything changes. And also the adolescents that I operate on them, that the eyes get straight, they come with another case. They come so happy. So
you're helping not only with their vision, but with their self-confidence, with their emotional interaction with other people, with what they can do for a living, with their job opportunities. It's amazing how many things are connected to the eyes.
It's huge. And people really don't think from this point of view, and I think that
sounds really, really important. Are you seeing any changes in the types of eye problems that are being presented to you? I always think about, when people say, too much screen time and how it's damaging to vision. Is that something that you're seeing happening?
So one of the things that happened is the epidemic of myopia or nearsightedness that we are having.
I say this with my glasses on.
No, but myopia and nearsightedness has been increasing through the years. More than 80%, even more, of kids in Asia, for example, wear glasses. And one of the things that I tell the parents, what happened many centuries ago, we need to have a perfect vision because we have to get the food. We have to kill the animals and we have to have perfect vision. But now everything comes in front of you. So
that's true.
And
just order it on an app and there it is. You didn't have to go kill anything.
Exactly. So in the past I didn't see any primitive or any people with glasses. But the real thing is that the scientific don't have a clear explanation why we are developing a lot of myopia or nearsightedness. But I know that the scientific community is really working very hard to see why the human eye has been changing to be more myope. And obviously, the use of devices has been playing an important role on that. And we see even more frequent, more patients with myopia. There is no doubt about that. And how to control the myopia has been very difficult. So there is no doubt that we have to regulate the amount of screen time. And many parents tell me, Dr. Aguilera, just remove the tablet. And me? I didn't buy the tablets. You were the one. So figure out what you're going to do. Talk to them and say, well, if you're going to remove or regulate the electronic devices and the tablet, you need to give another alternative to the kids to do it. Because that means more activity outdoor, more print a book, other, the same
like
thing.
what we used to do, go play outside and go ride your bike and read a book.
But it's very easy now. You see with the phone and the tablet, the
it becomes a babysitter.
Exactly.
Yeah.
So, but yes, this one has been changing. But I have to tell you something. I have the luxury to be doing ophthalmology for so many years. So ophthalmology per se has been changing a lot for good. There is no specialty that comes to my mind that has so much advance in the diagnosis, in the treatment, in the perfection of the surgical technique that we have in the last 25 years of practicing for better. The new surgical equipment are amazing. The complication rate in cataract surgery is by far one of the most frequent procedures that we do as an ophthalmologist has been decreasing to less than 5%. That is because of the surgical technique has been improving. And also the treatment, the new treatments in terms of medication, and even the new, the development, the genetic laboratory to try to find the reason for the degenerative condition that we didn't know has been amazing. I'm so thrilled to be part of this changing. I'm seeing the ophthalmology that I used to practice back home almost 30 years ago, and now to see how being part of all of this has been really amazing.
When you think back, do you remember your very first surgery?
Mm-hmm.
Tell me about it. What was it like?
Obviously, my the first surgery was intracapsular cataract. Intracapsular cataract, at that time, we had to do a very big corneal incision of about 12 millimeters and remove the whole lens with a cryo probe.
Oh, my goodness.
And remove the whole lens. And I was so excited. I used to keep with me all of the lens, very brunette and just very hypermature cataract with me. I collected all of the intraocular lens because it was very exciting. And then, so you give it back the vision to the elderly person at that time was really, really fulfilled feeling. Because when they come to us, the vision was really, really bad, like a 2400. That means that they have to be at least 400 and 20 feet to see at 20 feet what a normal person can see at 400.
Oh my goodness!
So just giving back the vision to the elderly person was very nice for me to see the next day. But obviously, I was in the transition from the intracapsular. Was a very gross microsurgery procedure at that time. Then the perfection of the technique. For extracapsular, and now we have an incision of only 1.5 millimeters.
So how long would the procedure have taken then versus now?
Yes. Well, actually, when you do intracapsular cataract at that time, it was about 20 to 35 minutes. And now in adult, they can do it even faster. But one thing that I want to make people to know, that no matter how the technique has been improving, and the result has been improving, cataract surgery continues to be a very difficult procedure, and I do not recommend the people to rush and just figure out that I did in 5 to 10 minutes, that you can do it, but it gives you the full perception to the patients and the rest of the surgeons around us that is a very easy no. You need to have a very, very, very a hard learning curve and a very high training to do cataract surgery.
So selecting a highly experienced surgeon is critical to the outcome.
And this is important to know because people think, no, it go in and out. I always tell my patients, doctor, how long do you want to take to do that? I say, the time that allow me to do a good job. Okay?
That's a great answer.
Exactly. It doesn't mean that I can do in 10 minutes, 15, 20, 30, depending on the complexity. It took me many years to go to the point that I'm able to do a cataract procedure very quickly, or a strabismus surgery, or a lacrimal system surgery, or a plastic surgery. No, it takes a long time. So I want just to clarify that, okay? Because I don't want to minimize the brilliant job that the intraocular surgeon do to establish the sight to a patient.
Definitely, that sounds really important. And so is there anything that you would tell parents today to help protect their children's eyesight?
Mm-hmm. Yes. Number one, just to be aware of any kind of symptoms taken very seriously. Number two, even before you have the baby, you need to have a healthy lifestyle. Okay? If you have a chronic condition, you are planning to be pregnant, try to be optimal for your pregnancy, have a good health, because there's a lot of malformations in the eye malformation that can be prevented if you take care of your health during the pregnancy and your age. So once the baby is born, just to make sure if you notice something that you don't like in the visual behavior, just tell the pediatrician, insist to get a very highly specialized a person like a pediatric ophthalmologist to check your eye. Don't wait for that, because it's better safe than sorry. Again, just a safety issue. Be careful with the toys that the babies and the siblings have, because sometimes they bring me the baby that the older sibling is playing. Make sure they have a very safe environment. Even the sport safety is important in kids, and go. Again, don't wait to see the patient. The provider. The other thing is a good health, a good habits, not toxic habits around the kids is important. Protect against the sun. So many things, Diana. Also, what the baby or the child eats is important, because the eye is part of the body. It's not independent. If the baby has a chronic condition, make sure ask the doctor to send it with ophthalmology, because a patient that has, for example, eczema. They are exposed to steroids for a long time. They can damage the sight. If the patient has obviously, if the patient has asthma, has been on and off from the hospital, and they receive steroids that can give you cataract, increased pressure in the eye, go and check. If the patient has a condition that are using a highly risk medication, so go and check with the ophthalmology, because they can be toxic for the eye. So again, be careful about what the patient is, what treatment you are using, because it may affect your eyes. If what the most common thing, the most exacting thing, and the most fashionable thing now, the electronic devices. The electronic devices can damage your eye, because can get dry, can develop myopia, can get tired. But know also that is the lack of social interaction that the child is having, because they are attached to the phone. Just through it may affect the eye and the musculoskeletal system, but know also that the parents are requesting more interaction with the child. When they asking doctor stop them to use the device, they want more communication with them. They have to explore this beautiful world. If we already gave a beautiful eye, you said
use your eyes
to
see things better than your device.
So Diana, we can be talking about that. You see, about that. But yes, for the parents, pay attention to that and don't wait. Request our help, and we will help them. We are the hope for them.
Well, so talk to me about iHope. So after 30 years of practicing in a hospital system, you've decided to launch your private practice. Tell me about that decision.
Okay, Diana, this was a very tough decision, but as you see, I'm part of the big group of providers that are still a little frustrated about the burden of the administration and the complication of the complicated that the health system is. My dream job was to be in a children's hospital in an academic setting because I love to teach, and I love, again, because I was former training as a pediatrician, general pediatrician first. I want to have this interrelation with my colleagues, and also because I do not see the eyes a part of the body. I see the eyes as part of the body, and that was my dream job. However, the fact that we work in an academic institution and we didn't receive all the conditions that we really wanted, and I didn't have this amount of time to dedicate to my patient and also to balance my professional life. And after being in my previous job for almost 7 years, gave me the big platform to do more. I was I was having the feeling that I was encapsulated in only one thing, and I feel that because of the knowledge that I have through the years, and the capacity to be in so different places, even back home with very few resources, and here in the States with so many resources, and I've been training the way that I was training. I think I was able to. I feel that I can do more for my community. I cannot even speak kids. I can expand to parents, and I want the parents and the kids have a very honest opinion. Sometimes that's what they want. Somebody with the knowledge that I have to have a real and honest opinion what is going on with the eye, and I feel that I can do more in this regard, and I want to also to organize my time and balance my life better and explore this new charter that the America that I knew and discovered give me the opportunity to have my own
something you can put your name on that you
exactly.
own, yeah.
It's just the ultimate American
dream. American dream, right? To start around. And
I feel that was the moment. That was the moment, and that I say, yes, I'm ready to do that. I'm ready to be in my community, helping the whole family. And I think that's the moment. That's the real thing.
So we're sitting in I Hope Clinic just before opening, and there's been great progress I see with the construction. Tell me about the types of procedures, the types of patients that you plan to see here.
Mm-hmm. Well, here where we will see mainly, I love to treat kids, okay? So the most frequent problem that we have in pediatric ophthalmology is strabismus that we were talking previously, misalignment of the eyes, okay? So that can happen since birth and can happen during the childhood, that can happen in the adolescent too, and adults. So obviously that's going to be my strong part of the family. But also we will offer checking for regular glasses, we're going to do contact lenses, we're going to treat patients with other conditions such as lacrimal system obstruction from congenital to acquired that we can see in adults. Also very minor procedure in terms of cosmetic as well. We can do also that. We will treat patients with glaucoma as well. That is very important. And also patients with ocular manifestation of systemic disease that can happen in patients with hypertension, patients with diabetes, etc. So we are creating this space with as we call it, state of the art, the new equipment, etc., to treat every single eye problem. There is no limitation. We will do minor procedures here, stitch, lesions, eyelid procedure as well here in the office. But this office will be equipped with all new equipment, state of the art again, ophthalmology practice. So we won't have any limitation to to see any kind of patient, including trauma. Okay?
Including trauma.
Yeah.
That's exciting. So, and if somebody requires surgery, I understand you still have privileges with the hospital, so that's still a possibility. So this really becomes the place they should go for any eye concerns.
Well, if we have to do intraocular surgery in kids, we will do in Miami Children's, Nicholas Children's Hospital. We still have the privilege that over there we will operate extravision and cataracts, and one of the few providers in South Florida to do cataract surgery. So I will continue doing that, and also in the ambulatory surgical center that is in SIU that belong also to Nicholas Children's Hospital. We will do outpatient procedure. We also have privilege in Kendall Regional Center. That is a practice. It's an adult for adult and kids as well. It's a trauma center that we can do that. We are in the process to get the privilege. We already submit for Baptist, so we will do adult surgery in Baptist as well in other hospital in the area. So the most complex procedure we will do in the close by hospital surgery center.
Right. And what can a patient expect when they first come to iHope Clinic? What does their first visit look like with you?
It will be family. Patient that come here will be treated as a family. Quality of time, very short wait of time. I hate to be, waiting for a long time to be seen. Even in my previous job with the hospital, I worked really hard to make sure they come and just say, as I say, quality of service with efficiency is my vision. Efficiency and quality of service. This is what I wanted. So to be there, to provide a very high quality of service in efficient way, very few people have it. And all of this year studying, and I have been studying a lot, okay? But no studying only, but studying and at the same time seeing patients give me this capacity to see your eyes and have the idea what you have in a very few minutes and treat it correctly. Sometimes the patient say, "Doctor, you just stay with me 5 minutes." No, I have been 30 years.
It took 30 years to spend those 5 minutes wisely.
That's true. Sometimes I have the resident there and say, look at the game, just pay attention. What I look at, how you can do in 5 minutes. No. I have been, Diana, how many times, how many eyes. I think a lot. But again, when you come to iHope, I will be the hope for your eye. If there is something that I cannot resolve, I want to make sure you will get a second opinion with the most experienced, somebody that I trust. And that happened with all my other patients. When I have something, I find something that I cannot resolve, it's not in my hands, and make sure you will have the best provider. If I cannot do it, sometimes the best provider will be me, but if not me, I'm not, playing with your eye. No, because again, when you come in here, your eyes are not your eye anymore, are my eyes, and I take care of my eyes a lot. So
that's so important.
Yes, that's true. That's what I do, and I'm not forced to do it, because it's what I know to do. I don't know to do too much things, but I know how to do it.
You know the eyes really well. And it sounds like whether you're a parent and you're concerned about your child or an adult, that's similar to how we're taught here in South Florida that proactively we need to make sure we go and see a dermatologist regularly to get our skin checked out, that we should probably come and see you regularly to get our eyes checked out and just make sure that everything is functioning as it should.
I agree. That's a way.
And so when does iHope Clinic open?
I hope it will be open. We have full schedule already on January 15th.
January 15th.
So whatever is pending here in the clinic has to be done, because in January 15th I have my full schedule patients here. So
That's exciting. Congratulations on the change, Doctor. It's been wonderful having a conversation with you. I've learned a lot today, and I'm sure our listeners have as well.
Thank you so much, Diana. You're having a big support for us in this new chapter of my life. I hope it's not the last one. And I just want to tell you one more thing, Diana. When I try to put a name to my business, the name implies so many things. First, the whole that you have, again, a highly trained physician to take care of your eye. That is very important. And also, if I didn't mention, but my mom's name is Esperanza. That means hope.
Oh, I didn't realize that. That's a beautiful connection.
And I want to do something also that has her name. And my mom has been my hero and my inspiration, and she's going to be 90 years old soon.
Bless her.
Yes. And I want, before she go to a better place, that she see what I was able to do and put something that has her name.
That's beautiful.
Because when she was pregnant with me, she was overwhelmed with 4 kids, and she didn't want to have more kids, and I came. So I wanted always to show my mother that was worthy to having me, and I'm pretty sure she knows that very well.
I'm sure she knows that now.
And that's part of the name. And some people say, why do you say it in Spanish? And was because it's more commercial, more.
Sure, people would recognize it more, and it's nice having a connection that you know about that connection.
Yes, exactly. So that's what I wanted. I didn't want to finish this conversation with you, just to let you know that the name also is because of my
mom was my hero too, so I can completely relate to that. That's beautiful.
Well,
wonderful luck with the clinic. I'm excited that you're finally about to open, and everyone who is interested in caring for their eyes should come to Eye Hope Clinic.
Yes, welcome. Thank you, Diana.
Thank you.